Welcome to our latest episode of the Lebanese Physicians Podcast. And today is a special episode for World Diabetes Day. We will be discussing diabetes management in Lebanon with Dr. Kassouf Maalouf, who is the founder and president of DiaLeb, which is the National Diabetes Organization, a leading diabetes organization in Lebanon, which she founded with her daughter, Sylvie, who was living with type 1 diabetes in 2010. Jackie is also the current vice president and global board member of the International Diabetes Federation, and she's a certified diabetes educator. And of course, she has 13 years of experience leading DiaLeb at this point. One thing I think we're going to discuss it with Jackie in a bit is I think her background is not in diabetes, so we can discuss that. Jackie, welcome to the podcast.
Thank you, Khalil. I'm very happy actually to be here. It's an honor to be your guest. I've watched many of your episodes, very interesting guests indeed. So thank you for having me.
No, thanks for being here. So Jackie, before we start, I was gonna discuss with you how did you get into? We can discuss that point. How did you get into diabetes? And because your background, can you tell me a bit about your background? I know you've studied in the U.S. before, and how did you get into being interested in diabetes and diabetes education and care?
I will answer the same way I always do when I'm asked what made you interested in diabetes. Actually, diabetes got interested in my family. And this is how it started when my daughter was diagnosed with type 1 diabetes. As you mentioned, my background has nothing to do with the medical field. I have a PhD in public relations and communications. I've taught at universities. So it was like a completely different path. But I always believed that sometimes you just have to answer the call. It may happen in different ways. So, and I won't lie, I will admit that when it happened, we had those moments of why me, why my daughter, why is this happening to us? The moments where you feel lost, where you feel challenged by life, where you feel close to being depressed. This will be the case of every mother or parent for that purpose, or person when they are being told or diagnosed with diabetes. But my message today is a message of hope. Yes, we have the right to go through this. Yes, we are human beings, but we should not stay in that stage. This is my message. We need to get out of it. And what a better way than to think how to help others. Then you forget your own distress, you forget your own problems. And here I have to say that my daughter, and I should say my hero, she came up with the idea of creating this association. And of course, I was next to her, holding her hand, saying, let's do it. But I told her, you may have to come on interviews and speak and say, I have type 1 diabetes, you're a young lady, because she was not at the age of a juvenile diabetes, which normally, as we know, is diagnosed for children. She was actually 24. She was engaged to be married, and which made the situation even worse because you don't expect it at this age. So no matter how difficult it was, I like to remember this episode with hope and be grateful and be happy with what we have achieved so far and the impact we have created in our community. And this, I think, is something we are entitled to feel a little bit proud about.
Right. I mean, you've made, I think, a lot of people, when such things happen to them, they despair and they say, why me? And what you did, and I think I've heard other stories like this where people develop NGOs afterwards. It happens to you and Sylvie, your daughter, but then instead of despairing, you go about and say, all right, let's create something to help others with the same diagnosis and the same disease, and that's a tremendous effort.
Yes. And you know, Khalil, sometimes you start with passion and a lot of enthusiasm, but I've seen it happen with many people that the enthusiasm like fades away with time because there are many challenges. Thank God with our determination, it did not happen. We grew more than maybe we wanted to, and not financially speaking, but impact-wise. And this is what really makes me feel good about this. And as I told you, I was very far from the field. But my background helped me to manage an NGO. Knowing marketing, teaching marketing in universities, knowing how to do a business plan is really helpful when you're running an NGO. And on the other hand, I took like a promise to myself that I will educate myself. And I believe there is no age for that. So I became a certified diabetes educator. I did several courses in nutrition, many courses of public health. I didn't want to go for another master's or PhD because it means nothing to me, the diploma itself. What I care about is the knowledge, is the feeling that, yes, I am entitled to speak about those topics from epidemiology point of view, from statistics point of view, from public health point of view, and I leave the job of the medical doctors like yourself and all the physicians, and because I believe we complement each other's mission.
Right, I agree 100%, because like physicians sometimes know how to treat patients, how to maybe do some research, but they don't know how to do marketing, a lot of them don't know how to run a business, although they're starting to learn now. But I agree. I think it's a complementary field.
Yes, absolutely, absolutely. And I take pride to say that maybe some of your guests are very well connected with our organization. For instance, Dr. Labib Ghalmiyi, and I send him a big hello from Beirut. He is on our scientific board, and actually our first awareness event, the very first one, talking about my daughter and her pregnancy and so on, because by that time she was already married and she had her first baby, a baby boy. Now she has two. They're perfectly healthy and fine, thank God. So Dr. Labib Ghalmiyi was our first speaker at our very first event at DiaLeb. And he still is a big supporter, and I really thank him for that.
Yeah, I'm not surprised. I mean, Labib is everywhere.
Yes, he is. Other than he is a good friend, but professionally speaking, I really admire his human side as a doctor.
Me too. Me too. So as we discussed the establishment of DiaLeb, so your daughter got diagnosed with diabetes. And how did you decide, all right, you and Sylvie, how did you decide, all right, we're going to establish DiaLeb? And how
Actually, what happened, it was like the sequence of things happening that automatically led us to this decision, because I felt a bit lost, as I said earlier, and I started looking on the internet, calling every number I would see related to diabetes. And what I found out is that in Lebanon, we did not have a diabetes organization that would somehow take care of the education of an adult being diagnosed with type 1 diabetes. There is a center that cares for children with diabetes until they are teenagers, maximum 16 to 18. So I felt like, okay, so how do I introduce my daughter to other young ladies or young gentlemen living with her same situation? Who do I go to? And there was nobody to go to. So I thought, let's be this organization to go to when someone is recently diagnosed, when someone needs support, when someone needs a piece of information, accurate information, solid information, when someone needs a shoulder, the program that's mostly dear to my heart is when we do a support group session for recently diagnosed. Because when you've been there, and when I say you've been there, yes, it's not me, it's my daughter, but every mother listening to this podcast would understand that it's like, it is me. There's no other way to see it. So I've been there. I know what it feels. And I would give whatever I have to avoid this feeling of being lost to another mother or another young person being recently diagnosed. This is why no matter how busy I am, no matter what project I have in hand, when I am called for one of those sessions or when we feel the need to plan one of our own support group sessions, this is priority. It is priority to me because you have no idea how helpful it is and what people, the feeling they come into the session with and how they leave the session. It's so powerful when they feel empowered because I'm not alone. Oh, here they are. This person has been diagnosed 10 years ago, and look at them. They live normal life. They have adapted because there is no other way to do it. You need to adapt to this new situation. I call diabetes another situation in life. Yes, it is a chronic disease, but I like to call it a situation. And we human beings are easy to adapt to other situations, new situations. Let's use this positive side of us and adapt to it, because when you learn how to live with diabetes, how to really make it your friend, you avoid complications and you definitely live a better quality of life. You see it now in all conferences, the QOL, the quality of life, so it really matters. What is the quality of life that these people are living? This is what we at DiaLeb care a lot about, and it is actually in our mission to enhance the lives of those people living with diabetes and their families, because the surrounding, the peer support is of utmost importance.
Right.
Yeah.
And I would say, which we'll discuss in a bit, is there's been a lot of developments in diabetes over the past couple of years that are making the quality of life of diabetic patients better, but a lot of patients still don't have access, let's say, to these new continuous glucose monitors or insulin pumps and stuff like that. So we'll discuss DiaLeb's role in this in a bit. But first, I wanted to ask you, do we know the incidence approximately of type 1 and type 2 diabetes in Lebanon and how it's been changing over the years?
Let me give some global numbers first. Of course, wearing my hat of Vice President of the International Diabetes Federation. Nowadays, we have, just to give an idea of how dramatic the situation is, but there is always a window of hope. So we have 537 million adults living with diabetes worldwide, I'm saying. But this is not the only problem. The problem is that it is predicted to increase to 652 million by 2030, and 2030 is a step away. And then to increase to 783 million by 2045. Why am I saying this? Because I would like people to feel depressed. No, not at all. I'm saying this because we have a tool in our hands. Yes, we cannot do anything about the numbers that we have nowadays, but we definitely can prevent those numbers from increasing exponentially. It's like 40% increase until 2045. How do we do that? We have a lot of undiagnosed people. We have a lot of people living in this shady area of pre-diabetes. Those are reversible. People need more awareness. And I'm sure doctors and medical doctors and all the healthcare professionals around people living with diabetes know that, and they're doing all that what they can. We are here to support, to shed the light on the importance of reversing pre-diabetes. This is another thing we are working a lot on, because only through awareness, only through changing lifestyle, only through incorporating physical activity in our lives, we can stop the rise of the numbers of people affected with diabetes across the globe. Now, when it comes to Lebanon, unfortunately, we don't have accurate numbers. The last numbers from the Atlas of the International Diabetes Federation in 2021 states around 9% prevalence of diabetes. My personal belief, and that of many other professionals in the field is that we are around 15%, not less, and maybe more, given that because of the situation in Lebanon, there are no accurate numbers, because all the challenges that we've been living lately, and I'm sure you're very much aware of that, but for those listening to us, the economic collapse, the unfortunate explosion of the port of Beirut, all these civic riots, and now the war in southern Lebanon, add to that the existence of several millions of Syrian displaced people has, made the problem really bigger than it should currently be. We try our best. The Ministry of Public Health is doing its part, but actually, I believe the numbers are more than that. Just to call the attention on something, whether globally or in Lebanon, type 1 diabetes, what we also call the juvenile, accounts for 5 to 7% of the total cases. It's not a large group of people, but it is very important to focus on and to educate, because they have a lifetime to live with diabetes as a friend rather than an enemy. So the 90 to 95% sometimes of the cases of diabetes are type 2 diabetes, which is preventable, thank goodness, but many people don't know that. They believe because they have a family history, then yes, they must have diabetes one day, which is completely wrong, because it's good to know our family history. It is a risk factor. Age is another risk factor, but we can work around those risk factors. We call them modifiable risk factors because we can work around. Smoking is a risk factor, but I can stop smoking if I'm a smoker. The non-modifiable risk factors like age, I wish I could go 20 years back, but I cannot. Nobody can. So let's focus on those modifiable risk factors to help our communities prevent diabetes rather than to look for how to manage it. That will come at a later stage if we do not succeed in preventing it. But I'm sure at least we will succeed in delaying the onsets of diabetes, even if we have a couple of the risk factors.
Right. And yeah, and this gets me into the goals of DiaLeb after it was established. Can you tell me a bit about your goals? I assume, I can say some of them, but then you can add if you want to. So it's prevention, potentially helping people treat their diabetes education, and education regarding prevention of diabetes. And then you've had a lot of community initiatives and collaborations along the way. But you can feel free to expand on this.
Yes, we were legally established in Lebanon in January 2011 through all the pertinent ministries and with all the legal papers. And since then, we have started a big number of projects and campaigns, and with very limited resources. I have to say that. Sometimes people think we are so many at the office, but we are not. They think we have a lot of money. We don't. But where there is a will, where there is passion, there is always a way to do things. So I will go very quickly about our programs because even their names are carefully, looked for, like diabetes in the classroom. We believe in prevention. This is why we visit schools and universities. We tackle nutrition topics with the younger students, where with the older students, we do the finger prick test. We call their attention that it can happen at any age and that type 1 is not preventable, but you can live with it, whereas type 2 is preventable, so be careful if you have it in the family. We have another program, Diabetes in the Community, where we tackle purely the communities where we have the majority with type 2 diabetes. We do a lot of sports events to encourage the community to move, any type of movement. We have the Dear to My Heart program, patient support groups for those people living with diabetes, especially the young ones. We have a summer camp for young adults with type 1 diabetes that we do once a year. It's a 1 day. We like to call it summer camp to bring normality to our narrative, so nobody would feel that we are different because we have diabetes, you know? So we are very careful with that, including the term patient. We don't use it. We use people living with diabetes. And now it is used in most conferences, and this is something the International Diabetes Federation and the global board, which I sit on I'm very proud to be on that board. We have decided that this is the term we want to use, either PLWD, people living with diabetes, or people with diabetes, PWD. We also have a volunteer training program. This is very important. Not everyone can say, okay, I don't have anything to do today, let's go volunteer. It doesn't work that way. We need commitment, and we need a structure, and we need to train our volunteers so they can really help. And we even give them certificates for their volunteering hours. We have held many workshops. We've done a lot of workshops for professionals like dietitians, nurses, physical activity professionals, and even physicians, because we believe it should be personalized, and the care for the people living with diabetes should be really focused. We've done, as every year, World Diabetes Day campaigns, sometimes in collaboration with the Ministry of Public Health, the Ministry of Social Affairs, with other NGOs and other institutions, because we believe in collaboration. And recently, like in the last 4 years, we have started to tackle not only diabetes, but other NCDs, or non-communicable diseases, because they are interconnected with diabetes, and they are the complications actually of diabetes. For instance, we have partnered with Global Liver Institute from USA to celebrate with knowledge. That's why I use the word celebrate, through knowledge, International NASH Day, and to call the attention on the common risk factor, which is obesity. So this is an example. And also we've shed the light on the cardiovascular complications, which are very important to understand for people living with diabetes. What are the risks? How can they prevent them? Also, we collaborated with ophthalmologists and everything related to diabetes. The idea is to create a holistic approach with all types of professionals, where we have the person living with diabetes very well taken care of, in order to offer this quality of life that we talk about. And also, there is a program, Women and Diabetes, not in order to be feminists, but of course we have gestational diabetes only happening to women. And also the the studies have shown that the complications of diabetes are slightly more in women, and not exactly because of biological or physiological aspects, but because the mother neglects her health in order to take care of her family. So through that program, and we do an international webinar every year around International Women's Day, and we've had guests from Aruba, India, Europe, USA, Canada, Australia, and all of them are people I have met personally, and I know their impact in the diabetes world. And about the initiatives, if I want to speak about all of them, I will stay until tomorrow. So I will mention only two. One is diabetes medication for all, that we started right after the economic collapse, where we started getting a lot of requests of people not being able to afford their medication. So it was a response to a need. And then after the Beirut blast in 2020, we upgraded that initiative and called it Diabetes Relief Initiative, because at that point, it was a must for us as an NGO taking care of people living with diabetes to support them with their medication. So, and this initiative is still ongoing. We don't announce it much because of the limited resources, but we never deny medication to someone in need. So actually, as I mentioned, there is a lot of programs that we work on and sporadic projects, but mainly I spoke about most of them. And you know, the most important is to speak about the impact. I can put titles, beautiful titles, anyone can, but I'm here to speak about the impact that DiaLeb has created in the community in Lebanon. When we say that we support 507 families with their medication, it's a lot to say for a country in the situation of Lebanon. When I say that we have supported with insulin injections, with trips, with devices, with boxes, thousands of boxes of medications, it is with a lot of effort. So if I wanted to say how many people were impacted directly, they are 120,000 because we add them through every event we do. So, but if you want to speak indirectly, that is through education, workshops, social media, then we are talking about millions of people, and not only in Lebanon, in the region and globally, because we post our material in English and in Arabic, and that's an additional extra effort to us.
Right. Yeah, basically, and you beat me to this. That was my next question for you, was how many people you've impacted, and you answered that question. But but I think, yeah, I think when we look at the impact, I agree with you, because you look at the impact to the people you're helping, but also that's an impact to their families, to their children, and to probably society as a whole, because then they can be working more productively in society. So that's a big impact. So it's beyond the person that you're impacting in that case. So just to summarize, I think your projects are all the way from prevention to medication deliveries and helping with medications, to diabetes education, and to volunteer work and volunteer education, and then to participation in sports events and stuff like that. And as we go to the sports events, we'll talk about the Juni event in a bit. But I just wanted to point out, just for people to know, that prevention mostly targets type 2 diabetics, because type 1 diabetics, you cannot prevent that. That's something that happens to them separately. But
that's true. One thing I want to tell you, for instance, when I meet a parent, very coincidence, and they tell me, you know what, I think you visited my son's school. He came home and he was telling me about this lady or this doctor who spoke about diabetes, and it was so nice to know things they didn't know. This is where I know the impact. And that's why I know if we have 100 students in the auditorium, you need to multiply that by at least 3. Those are the impacted people, and it grows exponentially. Now, why are we stressing on physical activity? Because we know to prevent and well-manage diabetes, we have 2 important key factors: healthy nutrition, which leads us to healthy lifestyle, and the physical activity. And let me tell you, the title under which the International Diabetes Federation is going to be working the next 3 years is well-being. It will be announced in November. This year, the big title under the umbrella of well-being will be the physical activity. That is why we will be doing activities such the walkathon in collaboration with the Junior municipality, where people will walk together with us, our members, for like 45 minutes. We will get to the municipality building. We will have glucose testing on the spot, then some refreshments, then an awareness session with an endocrinologist and myself, speaking about the facts of diabetes, some myth that we have in the society, to tell them which are true and which are absolutely myth. And we will also be with a tent at the Beirut Marathon, as we have done for the last 14 years. We have a tent, we perform glucose testing, we have students, volunteers with us, and we distribute educational material because we want to motivate people to walk, to run, to bike, to swim, to do yoga, to dance if that's what they like to do. Just move. This is the message. For example, the walkathon we're talking about says one step can make a difference. And it can, because one step will lead to another, and then to another, then to 100, then to thousands of steps. So this is how we are tailoring our events this year under this umbrella of well-being, continuing with our ongoing awareness sessions, but adding to it the flavor of the physical activity component. For instance, we will have a series of events for type 2 and type 1 people living with type 1 or type 2 diabetes at a gym where I had an agreement with the trainers, where I do actually my personal training, and we will have awareness and hands-on activity at the gym to highlight the importance of moving, of starting, of taking this very hard, sometimes first step. And we will also have multidisciplinary panel with the Modern University MUBS of Business and Science. That will happen during October, again in preparation for World Diabetes Day. And through that conference, the audience will be varied. There will be medical students, there will be students, there will be community, and we will, of course, have nutrition consultation outdoors, and we will have glucose testing, probably HbA1c, BMI, all of it to create this awareness circle, if you want, to insist on the fact that type 2 is preventable. If we are already living with it, it is manageable. So this is the bright message, if you want, because I'm a positive person by nature, and you cannot work in this field if you are not positive. It will get to you tremendously. So I like to feel that when people tell me, oh, this is contagious, you speak about diabetes with a smile. Yes, because I'm a hopeful person. I hope for a cure. Meanwhile, I hope that people will live a good quality of life. I hope that people will care for their physical and mental well-being in order to achieve this so wanted good quality of life. So this is our message at DiaLeb. And again, we are few people. We do a lot of effort to be on all social media portals. And I would like to do a call for whoever is listening to us to follow us on social media. This maybe insignificant click to them means a lot to us. It is what pushes us forward. I forgot to mention something. If you allow me, I want to mention it now. That in order to be able to receive donations for our medication for all and diabetes relief initiatives, we registered DiaLeb USA as a sister NGO to DiaLeb Lebanon with the sole purpose of supporting DiaLeb Lebanon financially. So given the situation here, and you know it very well, we had for a couple of years a lot of difficulties with banks. We still do, actually. So that helped us a lot. And people can go on the website and they can support if they wish. And I would like to say another thing, that I believe in collaboration. I believe in joining hand in hand. This is why we collaborate with any organization who extends hand to us. And because we work on sustainable health, because we believe in the Sustainable Development Goals, we particularly stress on goal number 3 related to health and well-being, on goal number 4 related to education, goal number 5 related to gender balance and gender equality, and goal number 17, which is partnerships to achieve the goal. So I don't know what else I could say, but we have a lot of international affiliations. which gives us more credibility. Maybe I'm jumping to your questions. I don't know, but I feel
Yeah, that was my next question, was your international collaborations, because from what I've seen is that DiaLeb has actually impacted some of the diabetes associations in the Gulf countries and beyond.
Yes, actually, whenever we get an email or a call or we meet in person at any event with anyone who's wishing to collaborate, we started immediately to brainstorm and to see how we can, give life to this collaboration. And actually, I would like to mention that since 2016, we were founded in 2011, as I mentioned earlier. In 2016, we became members with the International Diabetes Federation, active members, I should say, since I am currently the vice president at the board. And in 2015, we became one of the very first members with the UN Global Compact in Lebanon. We are also members with the WHO GDCs. This is recent, in early 2024. I'm not going in order here. With the World Patient Alliance since 2020, with Catalyst 2030 working on sustainability since 2021. We have a contract with the Ministry of Social Affairs in Lebanon since 2018. We are members at Giving Tuesday since 2021. We are partners with Global Liver Institute since 2021 as well. And I'm happy also to say that I sit on the board of the NASH Council in the US. And I think I'm the only one, I'm positive actually, from the MENA region. Because of this recurrent collaboration with Global Liver Institute, I do attend the NASH Council meetings. And I believe that the more we dig deeper into knowledge and we give more information about diabetes complications, and we let people know how they can prevent them, and yet that, yes, in most of the time they are preventable, I think we would be going one step further toward our mission to stop the rise of diabetes in the world.
And Jackie, just to add, I think you're also a registered 503c organization in the US.
Yes, yes.
Because that's important for people who want to donate in the US.
Of course, we are registered under 501c3 as DiaLeb USA. We have done limited activities in the US, but mostly we receive donations to be able to continue with our medication program and with our activities, and to create even greater impact in our community.
And I see a lot as we end the podcast. I just wanted to point out, when I look behind you, there's a lot of awards that are behind you. Can you just point to a couple of them, tell us about them? Like the hand, you have the golden hand.
Yes, this, let me see, this golden hand was, it was a very touching moment. It was offered to me when we completed the 5th anniversary, because as I mentioned earlier, many people thought it was an emotional moment when I started, and that I will get tired of it because there are many challenges and it's really difficult, but it's not the case. I'm very determined to go on because it is my mission in life. So the team offered this to me with the group of people living with type 1 diabetes. The other awards are from either regional or global conferences I have attended, or local. And some of them are, with the army, with the Lebanese civil defense, with the Lebanese Red Cross, from conferences in Saudi, in Dubai, in Morocco, in Algeria, in so many places, from Brussels, so many places in India. For instance, last year, I'm very fortunate to be able to spread this message of hope and speak about DiaLeb's journey in so many places. I really feel blessed and fortunate, and I am grateful for everyone who supports us, because they're not supporting DiaLeb. They're supporting the people who are living with diabetes. And I
Jackie,
thank them from my heart.
Jackie, this was a great introduction, I think, to DiaLeb and discussion about DiaLeb and the tremendous work that you and I think a lot of the DiaLeb members have done over the past 14 years to impact a lot of lives in Lebanon. As we discussed, more than 120,000 people, and a lot more in terms of families and social impact. Thank you for the discussion, and hopefully we will meet in person soon when you come to DC to visit your children.
Yes, absolutely. And I would like to thank you once again for having me on your podcast. And I would like to thank whoever will watch this podcast till the end, because we spoke a lot and there's a lot of information. So thank you, and big thanks to them as well.
Thank you.